Hi, I'm Amy, the Managing Editor at Women's Health, and welcome to the first in our series of interesting after work from home convos with our team, experts, and stars. Our discussion tonight has been themed, the one about anxiety and coping with change in an ever-changing world. Tonight we will be discussing tips and tools for managing stress and anxiety, learning how to embrace adaptability, and your other mental health lockdown questions answered. Here at Women's Health, we know that our mental health is as important as our physical health. Joining us this evening are three amazing women from the Palm Tree Clinic, a boutique private mental health clinic in Cape Town. We have Elise, a clinical psychologist, MARIAAN, an OT, and TAMSIN, a medical doctor. I'm going to begin by asking each of our amazing experts to introduce themselves and tell us a bit more about the work they do at Palm Tree Clinic, starting with you, TAMSIN.
Hi, Amy. It's such a honor to be with all of you this evening, and I'm so grateful to, obviously connect with all of you. So thank you so much for everyone that's tuned in. So my name is Tamsin, or Dr. Malengret, if my father-in-law is watching, just so I say it the correct way. I'm a general practitioner as well as the hospital manager at Palm Tree Clinic. So I have two roles there, but just to start off a little bit about myself, before going into medicine, I was very much passionate about the community, and that's what drove me to study medicine, which I actually completed my degree at the University of the Witwatersrand in Joburg. And then it was during my internship time and my community service time that I realized, there's so much more to the human body than just the physical symptoms. A lot of the times people want to come and just be heard. And that led me down the path of psychiatry or mental illness. And that's where I find myself now, working at Palm Tree Clinic as a GP as well as the hospital manager. So I've been there since last year, January, and I basically do two things there. So, firstly, I am the hospital manager. So, in terms of managing the facility, that's where I come in, making sure that the facility is safe and that, we have a really good program available for everyone that comes there. And then the second role that I fulfill is as a doctor. So, yes, I am a medical professional, and mainly what I do is I manage the medical side of things. So we will all be chatting today about our different roles as a team at Palm Tree Clinic, because we very much are a team. And I think it is important to highlight that mental illness is about teamwork. So we all do have a little bit of a different role in terms of what we do, in terms of what we manage. But again, just to highlight that, we need to have healthy minds to have healthy bodies, and that's essentially what we do at Palm Tree Clinic. So I'm going to give it back to you, Amy, to chat a bit more with everyone else.
Thank you so much, Tamsin. Next up, I'd like MARIAAN to please introduce herself and tell us a bit more about her role and what a day in her life looks like in the clinic.
Thanks, Amy. I'm MARIAAN. I'm an occupational therapist, and I've been practicing for the last 8 years in psychiatry, which is a weird field for occupational therapists. Most people don't really know what our role is in psychiatry. And basically, if I had to summarize it, it's as opposed to talking therapy, doing therapy. So skills-based work and coping mechanisms to help you overcome barriers to fulfilling the roles that you want to fulfill and that are meaningful in your life. So I'm very honored to be part of the team at Palm Tree Clinic and to add to the services that we offer there in terms of helping people to do what they want to do.
Awesome. Thank you so much, MARIAAN. Elise, would you like to introduce yourself and tell us a bit about your background and your role at Palm Tree Clinic?
I'm ELISE BEEBY. I'm a clinical psychologist. We've got various fields of psychology, but I specialized in the field of clinical psychology. A psychologist looks at the mind of a human being and also at the treatment of a patient. And if you're a clinical psychologist, you really assist with the actual diagnosis, assessment, and also with the therapeutic program at Palm Tree Clinic, which is tailor-made. I'm one of the co-founders, and I started the clinic because I was very distraught at the way psychiatry was treated in the world. So I realized that if you're going through a psychiatric illness or problem, that you need TLC, you need tender, loving care, you need to be understood, heard. And that's why I decided with fellow colleagues to start a boutique facility where we run a specialized program and where every single patient or client is important. And that's all about me. I finished at the University of Rand Afrikaans University, and I've been involved in various businesses, but at the moment I work from Palm Tree Clinic, and my favorite field, because I'm a psychoanalyst, would be hypnotherapy. And also, I love ego state therapy. I'm one of 4 psychologists there, and they all specialize in their own field. So a patient gets the whole holistic model. And if the patient needs behavior therapy, then obviously the person that specializes in, for example, cognitive behavior therapy will be allocated to attend to the patient.
Perfect. Thank you so much, Elise, for taking us through that. Last week, we asked you, our audience, some questions and polls on Instagram just to get a gauge on how we're all feeling during this time. One of the questions we asked was to describe yourself in one word, how you are feeling at the moment. Some of the answers that we received were sad, confused, anxious, overwhelmed, exhausted, stretched, depleted, helpless, and tired. Now, TAMSIN, can you please talk us through how stress physically manifests in the body and what we can do to help ease these symptoms?
Sure, I can, Amy. So I'm glad that you've actually brought up this question, because I think for a lot of us, when we think of stress, we only think of the emotional or the psychological side of things about how we're feeling. But what's important to realize is that stress in itself is actually a physiological process that happens in the body. So when we are stressed, what we actually trigger is a system in our body that we call the fight, flight, or fright response, which works a lot in conjunction with our sympathetic nervous system. So that's a very, very complicated system in our body that targets all different organs. So from your brain to your heart, to your lungs, to your kidneys, to your gut. So you get a whole variety of symptoms in all of those different organ areas that present. But I'm going to just touch on some of the physical symptoms, because I think that's what people might not be certain about. I know there's a lot more focus on the mental side of things, but in terms of physical, you can get heart palpitations. So what is that? That's when you feel your heart beating and you feel that it's beating really fast and you're aware of your heartbeat. You can even get extremes like chest pain, or you can get extreme chest discomfort. You can feel short of breath. You can start sweating quite profusely when you're stressed. Also, in terms of your tummy, you can start getting very nauseous. If you think about the time before you had an exam, or like, for yourself, when you're before a race, you can get that feeling of nausea, and some people can even throw up, it can be that extreme. And then another important symptom that we also get is sometimes we get the nervous, little wee that we need to do. So that's, again, a lower part in the body that's affected. So again, just to highlight that stress is not just something that's in the brain, it's something that actually affects your whole body. And that's why it is so important to recognize when you're feeling that way, what do I do? And just to allude a little bit on management, I'm not going to talk too much about that here, because that's a whole different topic in itself. I think the most important thing to do when you feel stressed is to sit and say to yourself, hang on, is this stress or is this feeling that I'm having in terms of physical, is it because I'm stressed, or is it maybe because of something else? And that's what actually causes a lot of people to go to their doctors or to go to the pharmacy, because they have these physical symptoms and they're not sure, is this stress Or is there something actually wrong with my heart? Am I having a heart attack? And yes, it is important for us to make sure that, when it comes to the management of your stress, that we don't just assume it's stress. We need to make sure that you are not actually having that thing like a heart attack or an exacerbation of your asthma. So that is one of the first components in terms of management. And then once we've excluded all of that, then we can start looking at, managing your stress, because that's what we do need to do. So I'm going to swing it back to you, Amy. I hope I've answered your question properly for you.
Thank
So
you.
back to you.
Thank you, Tamsin. Totally hear you on all of those symptoms, and I think many of us can relate to them. I think all of us have been affected one way or another with the COVID pandemic and the change that lockdown has brought upon us. Elise, would you say that this is causing some kind of trauma, and what tips or advice do you have for those of us who feel like we are dealing with this experience and it's the trauma of it?
It's definitely a trauma, and we do all, and I don't think there's one of us that's going to get away from this unscarred. So I think the first thing we need to know and to do is to acknowledge that, yes, it is scary and it is traumatic. And some of us will be prisoners of perception. We'll stay in this state and we will develop a disorder if we don't deal with the feeling or the fear that tends to become unmanageable. So what do we do in this situation where we most likely will become scared and traumatized? First thing to do is obviously to normalize it. It is here. I actually call out COVID, I call him Covey now, and every morning I say, "Good morning, Covey, how are you doing?" Because he's part of our life now, and he's going to be part of our life. We don't know for how long. Secondly, I become very mindful and I live in the now. Where am I now? So I'm in the moment and I become aware of what's around me and I defocus a bit from COVID, which can become a preoccupation. If we're not careful, we will get addicted to COVID and we will sit in front of the TV morning, night, and noon to follow the news and to see what's happening. Because we are all in a very stressful situation where we fear our life. So, what do I further do? I go and I become very philosophical and I say, look, guys, life is just one big journey. It's like my father said, a very wise man, life is a university of hard knocks. And we are now busy with a hard knock. So you can't control what life throws your way, but you can control what you think and how you deal with it and how you grow from it. And that is another philosophy that I do. I also minimize the situation. For example, I'll imagine that I take off in a hot air balloon just to get some breathing space. I do also deep breathing and do a self-hypnotic trance where I take off in a hot air balloon and I look at everybody down there and I don't get so overwhelmed with the situation. And there's a lot of other tools that I think MARIAAN could discuss with you. And one that I also enjoy very much is where you teach people to go back into what's the worst of the worst today. Today, the worst thing that happened was when Cyril Ramaphosa said that. I go into the worst of the worst moment, and what he said at that moment, I freeze it. And I say to myself, it's frozen now. I'm back in that moment. How can I make it a better memory? How can I think differently about it? How is it going to help me to think in that way? And then I start making better memories and I find solutions and I move forward. Otherwise, I get stuck. Over to MARIAAN. She's an expert in coping skills.
Thank you, Elise. I don't have much to add because Elise is definitely the expert in trauma. But the one thing that I feel about coping in this time is that we have to remind ourselves that this is a temporary situation and that we cannot make any long-term decisions or long-term plans based on a temporary situation. And the feelings that come along with COVID are also temporary. And as Elise said, we have a choice of whether we want to attach to it or not. And I think that just keeping that in mind, that this too shall pass, helps to get us to the other side. Back to you, Amy.
Thank you so much, MARIAAN and Elise, for giving us such helpful tips. I think for many of us, for many of you out there, we might feel that our role or our identity has changed during this period. Moms have had to become teachers. Partners have had to fill gaps of, those that would have been your friends or your colleagues. MARIAAN, what would be your advice for managing your sanity and your happiness levels for if you're stuck at home with family, but also for those who are going through this alone and are living alone?
Look, I think the biggest challenge with being stuck at home is that we don't have that role differentiation that we usually have. Going to work, we step out of the mother role into the worker role, and going to see friends, you step into the friend role. And all these roles are like enmeshed at the moment because all the spaces is just one space where you have to occupy all those different roles. And there's no buffer between the different roles that we have to assume. What I find helpful and what I suggest is to try and keep your routine as much as possible the same as what it was before COVID. So get dressed, put on your makeup, contact your friends, have a glass of wine over Zoom. Just try and normalize the home environment as much as possible. If it's possible, have a dedicated time to spend with your kids. 2 to 4 o'clock is playtime. Mom's working the rest of the time. Have a dedicated working space and just try to differentiate your roles as much as possible to get away from that enmeshment. In terms of being alone, I actually am alone during lockdown. So I've had to figure that out as well for myself. And I think the big thing is that you neglect your social role. It's just something that doesn't feature anymore. And it's important to become creative about fulfilling that role. And I think most people have been very creative. And this is why we all Zoom experts now, and we, teleconference birthdays and nights out and book clubs, and just being creative about that. And again, just trying to keep to a routine of thoughts, making sure that you get exercise, making sure that you engage in the leisure activities that you enjoy, whether it's art or gardening, and just, basically engaging with what you were going to engage with anyway prior to the pandemic. Back to you, Amy.
Thank you, MARIAAN. As part of those stats and polls that we did last week, one of the results was that 27% of you said that you've had to deal with some kind of some loss or some grief during this time. I lost a family member during level 5 of lockdown, which was quite a difficult and a strange reality to experience, because I feel like there was a blockage when it came to the grieving process, not having a funeral, the usual kind of processes you might go through. Can each of you weigh in on the processing of grief, what we should do, what we should not ignore? Tamsin, I'd like to start with you and just hear your insights around that.
Thanks, Amy. Firstly, I just want to start off and say I'm sorry about the loss you had to experience. That's, never something easy to go through, even when you have your family with you and you have that support structure. So, I'm sure that was an extremely difficult experience for you and something that must have been very, very tough to work through. So, I'm just going to start off by saying that exactly what you said, grieving is a process. To lose someone is a process. And when we are hit with grief, our bodies and our brains can react quite differently. If you're someone that's already predisposed to having a condition like anxiety or depression, something like losing anything, losing a job, losing a family member, losing an animal, can trigger depression, or it can trigger anxiety, what we would call a precipitating factor in our realm of work. So in terms of my role in the medical side of things, if a person has now been pushed into an extreme depressive state or an extreme state of anxiety, that they are now needing medical management because of this grief that they are now experiencing as a result of a loss, that is where I would step in. But I just want to emphasize that medication is only a component of your management. Your medication is not going to take away that experience that you've gone through in terms of working through the grieving process, working through that loss. It's only going to really treat your symptoms if you are, maybe anxious or depressed. So Elise is extremely experienced in working through loss and what it means to work through loss. I mean, and this comes from some of the personal things that she herself has gone through. So I'm going to pass it on to Elise to just elaborate some of the steps in working through grief. So Elise, I'm handing over to you.
Thank you, Tamsin. And again, Amy, I'm sorry to hear of your loss. I think when we deal with grief and loss, I really believe that unless you sometimes have gone through your own losses and you've dealt with grief or the loss of a child, etc., you don't really understand what another person is going through. The first most important thing is acknowledge it. We all deal with grief differently, so don't tell anybody you've got to get over it now. It's you can't sit around and cry. We're all entitled to our own response. Secondly, we are going to go through certain phases, and it is absolutely normal to feel. And remember, feelings are waves, they will pass. It will pass, and it will get to a point where you accept. It's just how you're going to get there. And the first thing is that we go into terrible shock, and maybe you still stuck in a shock state, which happens if 1 minute you have a family member and the next minute they're just gone. So we get stuck in that shock. Can it be true? This is a dream. It can't be possible. And then we start bargaining. What if we did that? We should have seen that. How could we be so blind? And that can be a very dangerous stage, because we can then develop feelings of guilt and shame. What if, yes, but I want to stress it to all of you, unless you deal with the raw, bare emotions of loss, you cannot move on. So you've got to go there where you scream it out, shout it out. I get very angry when people say, oh, this person is going through extended grief. So what? If that person needs to wear his child or her husband's shirt and go to bed for a week wearing that shirt, and that is how she's going to be able to deal with the loss of her hubby or her child, so let her be. Be present, be mindful. As an astute psychologist, cry with your patient. It is fine. Be there. As humans, we all want to connect. And then only one gets to the wonderful stage of acceptance, where you realize that life is death, that we are actually just visitors to this planet. We're not going to stay here. We're just visiting. And we're either making this visitation pleasurable, or we make it very unpleasurable. So it's all temporarily, it's momentarily, it's in the moment, and then you can actually say a loving goodbye. A strategy that I often use is I do hypnotherapy, where I allow people to feel that the person that they've lost is right there. They can speak to the person, they can ask him or her whatever they want to say. They can feel that wonderful golden string between them and the person they've lost. So that all brings acceptance and moving on. And that is how I dealt with the death of my 2 children. Otherwise, I don't think I would ever have got over it. Thanks, Amy, and thanks for everybody listening.
Thank you, Elise, and thank you so much for sharing. And I'm also sorry to hear about the loss that you have gone through, but also thank you for sharing such incredible advice and great tools. MARIAAN, I don't know if you would like to add anything to this topic as well before we move on to the next question.
No, I think that, as Tamsin said, Elise is definitely our expert on the topic and has overcome a lot of loss herself. Maybe the one thing to just keep in mind is if you do go through a loss during a pandemic or a lockdown, you don't have the luxury of going through the rituals involved in grieving and the loss, such as going to a funeral, and those things are important. And I think maybe it's, just to create space in your own environment for little rituals that help you to cope with that loss. Back to you, Amy.
Thanks, MARIAAN. I think that was also such a great point. So thank you for sharing that as well. Let's talk about the difference between stress and anxiety and how to know when you're at the point when you might need to seek professional help. I know sometimes they can feel quite closely linked. Tamsin, perhaps you can talk us through the symptoms or signs to look out for, and maybe those, like we spoke about earlier, when patients come to you potentially initially, just understanding the difference between stress and anxiety.
Thanks, Amy. I just want to start off this question. It's a very big question, and I think it's one that we're all sitting with right now. And I do think it is important, again, to differentiate between what is stress, what is anxiety, but also just to touch on the fact that anxiety itself is a massive topic. There's many different types of anxiety disorders in terms of its classification. So I think for what I'm going to do, just to answer this question, I'm going to assume about, a lot of things that are sitting with people just on the basis of what's been happening with the pandemic. So as I said with the question before about stress, the physiological side of things, stress is a physiological response, whereas anxiety is more your mentalization of your stress. It's more about what is the psychological experience of your stress. So that is the main difference between the two. And in terms of what we are going through now, I think it's really important to distinguish between, am I experiencing an anxiety disorder, or am I experiencing an adjustment disorder, or am I maybe experiencing burnout? Because I think those are the three biggest things that people are sitting with right now, and sitting with them for different reasons. So firstly, just to touch on anxiety, I think I'm going to just chat briefly about all three, just so that people have an idea. When it comes to any anxiety disorder, how we look at it is its severity. So it's severity in terms of, am I only anxious at home? Am I only anxious at home and at work? Or am I anxious just all the time, irrespective of where I am? Obviously, if you are anxious all the time and you are not functional at home and you're not functional at work, that is severe anxiety. And that is anxiety that needs to be treated. At the same time, if you are so anxious that you are having panic attacks all the time, so you are getting these episodes where you can't breathe, you feel like you're having a heart attack, you're sweating, your stomach is out of sync, and they are happening really often, then I think you need to look at getting your anxiety managed, because it's now again impacting on your function. So we always look at any condition in psychiatry or in mental health about its impact on your function, because that will obviously determine its severity and whether or not you need management in terms of medical management, management in terms of OT input, or management in terms of psychology. So that is just anxiety in a nutshell. But I think I just also wanted to touch a little bit on adjustment, because I think a lot of people right now, they might think that they are having anxiety, but actually what they are having is maybe more of an adjustment problem, which we would then classify as an adjustment disorder. And the reason I'm touching on the difference between the two is because there is a difference. There is a difference between having an anxiety disorder and having an adjustment disorder. Firstly, the biggest difference is that adjustment disorders, especially if we're looking in the case of adults, I'm not going to touch on children, because children is a whole different topic in itself when it comes to adjustment disorders. But in terms of adults, it's usually temporary. they usually recover themselves, and it's usually a response to a stressor, and a stressor that persists for quite some time. And in terms of its management, you actually in these cases don't go really to medical management. You would only manage the symptoms if the person has symptoms. So maybe if their adjustment disorder is resulting in them not being able to sleep, or they are now depressed and anxious as a result of a problem with adjustment, then maybe you would look more at the medical side of things. But if they are not, if it's not with those associated symptoms, the first line of therapy is psychotherapy. So you'd actually then refer that person out to a psychologist to assist, with the psychotherapy component, and you wouldn't necessarily jump to medication. But again, just to highlight that if you are experiencing symptoms at the time and you're not sure, is this anxiety, is this maybe me struggling to adjust, and you are really genuinely concerned about your well-being, rather go and get yourself checked out. Rather make sure, this is not my heart, that I'm having a heart attack, because you don't want to just assume that the way you're feeling is because you're stressed or because you're not adjusting well, because sometimes these can be genuine concerns that your body is trying to say to you, listen, there is something wrong and you must go get that checked out. So if ever in doubt and you're not sure, don't just brush it aside and say, oh, I'm being silly, I'm just anxious, or oh, I'm being silly, I know things are changed, and this heart pain or this pain that I'm having on my chest is just that. It can't be a heart attack. It can't be, something else, especially with everything that's happening now with the coronavirus. Rather go and get yourself checked out, just to make sure that you are, also healthy from that side of things. So I hope I've answered your question. I know it's a really big topic, and I haven't even touched on the different types of anxiety. I'm more than happy to cover that another time. I think it is something we could cover. So yeah, I'm going to give it back to you, Amy.
Thank you, Tamsin. I totally hear you. It is a huge topic in and of itself, and I think definitely something worthy of its own discussion for a separate evening. I think just a little bit more on when you find yourself sort of overwhelmed by a feeling of anxiety, if you get caught up in some of those sensations or feelings, Elise, do you have some tools that we could use just to help calm yourself down and find your sense of equilibrium again?
Okay, I think you all know the importance of breathing. So the first thing that one needs to do is to breathe. And there are ways of breathing, and as Tamsin has put it out there to all of you, and I'm sure MARIAAN can also teach you how to breathe. But I think do a favor and go and be taught how to breathe properly. Most of us don't breathe properly. Secondly, learn how to relax and let go, and how to meditate and live in the moment. Today, it is very important to focus on meditation. I don't know how we're going to survive if we don't do that. There is a beautiful app called Headspace, and I think all of us should do that daily. That is two of the most important tools that I think one should use in this time of trauma and the pandemic. And then, of course, just realize that we are made to be together. So we can't be alone. So if you go through that, reach out, talk, find somebody that will listen and hear, vent. It's so important to vent. It's okay to vent. And you're also entitled to your wobbly. We all can go through a wobbly. Who doesn't? We won in woundedness. And I think once one normalizes it and you feel that you can talk about these things and you are not mad, then it's so much easier to manage it. Thanks.
Thank you, Elise. I absolutely hear you on the breathing. Learning about the practice of yoga and practicing yoga regularly myself, and breathing and meditation has been a change for my life. And it is an incredible tool to be able to tap into. MARIAAN, I wanted to ask you, what advice do you have for those perhaps living with a partner, or for those who have a friend that may be struggling with a mental health disorder? How can we as individuals help and support?
I think one of the things that people that struggle with mental health or going through a rough time needs is someone to listen. And it's important to practice your listening skills, to listen to try and understand. Often we feel like we need to help this person or rescue the person or fix it for them. And most of the time, what's important is to just try and listen for the emotion that they're trying to communicate, and to reflect that back to the person, to show them that you really do understand and that you're really trying to understand, even if it's something that you are not experiencing yourself or have gone through before. What people don't need is for you to give advice to them, unless they actually specifically ask for it. Giving advice in a situation like that can seem really invalidating, and you don't want to come across as if you're trying to minimize the situation. In my experience, when people need advice, they will ask for it, and most of the time, people just need someone to listen and to understand.
Awesome. Thank you for that. And it's such an important topic, just so that we all know that as well. For those of us who may be living with or wanting to help support someone, to just be able to listen. One of the questions that I've seen come up quite a bit, and this might just be because I'm cooking a lot and hungry all the time, but I do want to talk a little bit about emotional eating. MARIAAN, perhaps you can just also clarify some things around, like, what is the difference between just kind of, eating a bit more during lockdown, we happen to be at home, we're cooking a lot more, or are we using it as an emotional coping mechanism?
Yes, I think that's something that we can all relate to. Unfortunately, I myself do not cook, and I actually learned how to do that during lockdown because all the takeaway places were closed. So there are positive aspects to this and not so positive. I think it's important to differentiate between boredom and between emotional hunger and physical hunger. There is a difference between the two, and it's something that we often sit with our binge eaters. Is, are you hungry for company? Are you hungry for entertainment? Are you hungry for stimulation? Or are you actually hungry for food? And to be able to really connect with your body and be mindful of those sensations in your body, try and differentiate between what your needs actually are. So Elise mentioned meditation, and that's one of the ways that you can, upskill yourself in terms of mindfulness to understand where that hunger is coming from. The other thing is that eating to self-soothe is completely normal and is also sometimes good. We need to self-soothe in various different ways. The key is to differentiate and diversify, to not only rely on food to self-soothe, or not only rely on alcohol to self-soothe, but to try and combine different methods. For example, taking a long bath, or lighting a candle, or reading a good book with a glass of wine will make you rely less on only the glass of wine, for example, if you combine different ways of self-soothing. But what I also want to say is that, be kind to yourself. Don't be so hard on yourself. This is a pandemic. And if you need to rely on eating to get through it, then that's also okay for now. I think it's just about being aware of why you are engaging with the food and what hunger it is that you are trying to solve. Back to you.
Thank you, MARIAAN. I just want to go now to a couple questions that we were asked last week already when we did our Instagram polling. And I thought, Elise, perhaps you could help us with one of the first questions. How can one be positive in a negative space?
Okay, first of all, that is challenging. It is not easy. So first, I think it is important again, and I always come back to that, accept that. It is okay. it is negative. And once you accept that it is scary and it's negative, then you can find a solution and you can deal with it. And there's various ways that you can do that. First of all, you can go back and look at your life story and say, when did I go through similar situations that was so difficult, but yet I did manage it? What was different then? How did I think about it? How did I act? How did I react? Another way is to really be grateful, to start thinking of in terms of where am I now and what is still positive in my life, and to make small changes, little steps, one step at a time, and to recognize all your little steps and all your little successes that you've made or done, and to be very much in tune with your inner voice and your inner child. We all have an inner child, and that's why we need to nurture our own inner child, and we have to become a caring, loving, understanding parent to our inner voice and our inner child, and take full responsibility for our own behavior and our own choices, and learn how to connect and love our inner child. Over back to you.
Thank you, Elise. Tamsin, I'm going to direct this question to you. Another question that was asked last week. Someone was asking, how do you help someone else realize that their mental health is spiraling for the worse?
Thanks, Amy. Again, this is such a difficult. This is actually such a difficult task that someone's being faced with. To be concerned about someone and then to bring up that concern with someone can be quite scary. So I just want to touch on a little bit about what MARIAAN said about, there's a difference between listening and advising. Sometimes giving advice can be dangerous and it might be not taken well. But at the same token, if you are really concerned about someone, I think it is important to communicate that concern with that person. So you would approach that person and say, hi, I just want to chat to you. Can we maybe have a Zoom chat or a WhatsApp call? I just want to check in with you, find out how you're doing, and be honest and transparent with that person about why you are checking in and what are you aiming to achieve. Obviously, if you're meeting a lot of resistance and you are genuinely concerned about this person and they start placing themselves or maybe even someone else at risk, for instance, if it's a mom that's now adopted a really serious drinking habit and, she's often leaving her kids unattended at home, those kids are at risk. So something does need to happen in that situation. And again, your response then in such a situation would be quite different. It doesn't mean that we can't be empathetic. It doesn't mean that we can't be compassionate. It doesn't mean that we cannot understand or try and appreciate what this person is going through. But at the same time, we do need to protect those kids, in terms of their safety. So a lot of the times you get people coming to see you where they're worried about maybe a family member or a friend, and they say, I have this friend that I really am worried about and I want them to get help, but they don't want to get help. And exactly like what you asked, what do you do when they're spiraling? So I've already mentioned you can speak to them, but if they are not listening, then you can reach out to someone else. So you might be able to reach out to a family member if you're really well known to that family and say, hi, I'm really concerned about this person. Maybe can you check in with them? And you can then, ask someone else to assist. If that's not an option for you, you can always phone, a helpline. You're welcome to phone even one of us at Palm Tree Clinic, and we can then try and advise you from like a medical point of view, what is actually happening in this situation. Because again, if it's a serious situation where someone is at risk or the person themselves is at risk, it might be a very different management that you need to take in terms of this person might need to be in a hospital because they're now that unwell. And there are steps that you need to follow in that instance where there is resistance to getting the help that they need, especially if it's in the situation again where I'm always going to keep on bringing up risk, because that is how we stratify or that is how we look at management in terms of mental illness, is the risk in those situations. So Again, if that person is really spiraling and you're worried, speak to the person first. If they are worse off than before, and if they really start placing themselves or others at risk, get in touch with the medical practitioner or someone in the mental health care field to advise you on what to do next, because something then does really, really need to happen. So back to you, Aim.
Thanks, Tamsin. Such good advice there. MARIAAN, I'm going to direct the next question to you. And this is something I completely relate to. Since lockdown, all my goals and plans for the year have been cancelled. I feel lost. How does one cope with this change?
Absolutely, something that I've also had to wrestle with during this time. I think that, again, like I said at the beginning of our discussion, it is a temporary situation. So don't stop making plans. This time will pass and things will start returning to some form of normality. And it's important to keep that in mind and to keep looking forward to new experiences and new things. You know, our borders will probably not open for a while and traveling might be a bit difficult, but we can always travel within South Africa. And I think it's important to focus on the goals and the plans that you had for this year that can still happen. If you want to focus on eating healthier or training for something, or perhaps working on your self-care, all those things can still be done within the parameters of a pandemic. And actually, it's the opportune moment to really get to know yourself and what you want from life. That was my experience, at least, is I had to reevaluate my goals completely. But I think what's important is just to use small attainable goals just to build up your self-esteem a little bit, and to build up your confidence and to build up your motivation. Because at this point, that is the level that we're functioning on. We're not going to achieve self-actualization during a pandemic. So it's just important to focus on the things that you can control and the things that make you feel like you are actually working towards something bigger. Back to you.
Thanks, MARIAAN. So one of the questions we've received this evening, Elise, I'm going to direct this to you, and I'm just going to read the question now. How does a recovered COVID-19 person deal with the stigma from colleagues and friends? It's quite difficult to not be affected or to take it personally when people are fearful and almost prejudiced against you, even though getting the virus is not your fault and you are no longer infectious. It's very difficult and an emotional burden to not have anyone to talk to who has been through it too, as many people are afraid to share that they have had it due to the stigmatization.
That is a very difficult situation and a very strenuous situation we find ourselves in at the moment. And we know that in all mental health situations, depression at the stage there was a stigma attached to depression. Any mental health problem was stigmatized. So the first thing that a person in that situation should be allowed to do is to verbalize it, to talk about it. We should be able to normalize it. Who of us can say for sure we're not going to one or other time contract COVID? It can happen to all of us. It's not your fault. Life throws very bad balls or difficult situations to very kind and wonderful people. So it is what it is. It's happened, and we need to help that person to develop internal locus control as opposed to external locus control, so that at the end of the day, what people say and do are no longer that important. How you deal with it, how you got out of it, and being so thankful that you are actually still alive. You know, it could have been so much different. And I think all those things are important, and just to love yourself, to nurture yourself, to be grateful, to spend a lot of quality time with yourself, and to be less dependent on what people say.
Thank you, Elise. That's some really helpful tips and handy ways for coping and dealing with that. And I think I agree, we should talk about it more. And there have been some amazing female athletes who have come out who've had COVID and recovered. One of them was Mariska Strauss, who's a mountain biker. She's great to check out on Instagram and spoke about going through the process. So I have another question here, Tamsin, which I'm going to direct to you. And I think this is something totally valid and something that I've experienced as well. The question is, it feels like once that you have a panic attack, you seem to be more susceptible to them. Why is this, if it is true?
Okay, so again, a panic attack falls in with anxiety, all right? So when we're looking at anxiety, we need to start thinking about its severity. So if you are having panic attacks to the point, or if you're having anxiety, apologies, to the point that you're having panic attacks, it's obviously severe anxiety. So just to answer that question, once you've had one, how do you know if you're going to have another one? The chances are quite high, especially if you are already in a situation where you're quite anxious and more anxiety provoking things are being thrown at you, like what we find ourselves in at the moment, where we don't know what's going to happen next week. Are we going to be put back into level 4 or even level 5 because things are changing and the numbers are rising? So once you've had one, you can always have another. It's not a simple case of once you've had one, okay, cool, I've gotten the t-shirt, I'll never have one ever again. No, there is quite a high chance that you'll probably have another one. And there is something that can be done about it. It is an extremely, extremely distressing experience to have a panic attack. And I can understand why that question has come up, especially because of that. I'm sure that person doesn't ever want to go through that experience again and wants to know, oh, hang on, I'll never have this again because it was so horrible. But just to know that, again, it's your body's way of saying, listen, something is happening. Something needs to change. I need help. Help me. So yes, rather instead of focusing on, oh, I don't want to have another one, I don't want to have another one, focus on what can I do so that I don't have another one? What steps must I take now? My body said something to me, something needs to change. What do I do to bring about this change? So for a lot of us, we don't always know like what sources are out there. Who do we go to? If we've had this a panic attack, what do we do? So the first thing I want to say to you is, once you've had one, and if you're not sure even if it was a panic attack, go and see someone. Go and see your GP. Go and see a psychologist if you feel like this is definitely, a panic attack that I've had and I really just want to talk about it. You're never going to be able to work through it and know if you're not going to have another one again if you don't explore why you've had it. So again, just go find out what it is that you've gone through. Was it really a panic attack? Because maybe it wasn't. Maybe it was you having a heart attack. Maybe it was you having, an asthma episode. Don't just assume that it's something like a panic attack when it could have possibly been something medical. So rather go get yourself checked out, make sure that, medically I'm fine. And your practitioner, your GP should be able to tell you, listen, you had a panic attack. This is what I think you should do. I think for a lot of us, we aren't actually aware of the fact that if you look at anxiety and if you look at depression, it is actually a condition that our medical aids do cover. And I do want to bring up, that kind of component to it, because I don't think a lot of people are aware of that. I don't even think, I'm making a big assumption here, but I don't even think a lot of my colleagues in terms of being general practitioners are aware of the fact that a lot of medical aids do cover, in terms of the psychotherapy that you need when it comes to managing anxiety. A lot of medical aids do cover that psychotherapy, and it comes up in something called prescribed minimum benefits. So if you are worried and you're worried now, okay, I'm having anxiety, I've got these panic attacks, but I don't have the money now to go and pay for the therapy I need, because a lot of the therapy is psychotherapy with the psychologist. Again, the medical management is only a small bit of the big picture. I I urge you to go and reach out to someone like Elise, who's very, very known with PMBs and how it works and how you can get the help that you need in terms of the psychotherapy, because there's only a small role that your medication will play. And those resources are available. They are. So try and make sure that you check in with your medical aid and find out what I have actually got available to me and use it. It's your body's way of saying, I need it, so use it. So I hope I've answered your question, Amy. Back to you.
Thank you, Tamsin. I think this has been such a great evening. I think we probably only have time for one more question, MARIAAN, which I'm going to direct through to you. And I'm going to read the question now. My 16-year-old is diagnosed with severe anxiety and depression. However, over the past 70 odd days, his condition has improved tenfold. We have found that the slower paced lifestyle and removed outside factors have helped improve his condition. And if you can add to this or share your thoughts on this, that would be much appreciated.
I'm not surprised at all that that has happened in some cases. I think that we all are sitting with a feeling that life was a bit fast and full and overwhelming. And this pandemic has definitely given us a chance to reevaluate what is important and also what we want our lives to look like. How we spend our time. I'm assuming with a teenager, perhaps there was more time with the parents in this time. Perhaps there was less pressure from school, pressure from peers. I think what would be useful in this situation before this child goes back to school, because at 16, she's probably going to go back to school in about 4 weeks, if I'm not mistaken. But I don't. The point is, before the kid goes back to the school environment, maybe to just check whether there was something in the school environment that was the trigger. And, because that is the one variable we can say it definitely hasn't been there during the pandemic. And maybe to see if there's something that they need to help this child to prepare with, get him to a professional maybe. Like Tamsin said, someone like Elise who could help with them unpack what was working during the pandemic and make sure that they can maintain that newfound wellness or calm or peace into going back to normal. That's it.
Thank you, MARIAAN. I think for many of us, we have learned some of that, spending more time at home, more time with ourselves, to invest in some of those things that do create more calm and are helping us to feel better at home. I just wanted to say a huge thank you to the three of you for joining us this evening and sharing such beautiful advice and coping tools, and for really just being present in this conversation. I think it's been so helpful for me and our audience out there. So thank you so much. To everyone else, I just wanted to say that for more information on Palm Tree Clinic, you can visit the website palmtreeclinic.com or connect with our amazing experts here through Facebook at Palm Tree Clinic CPT, and on Instagram they're at palm.tree.clinic. So thank you so much, everyone. I hope you have a great evening further and a beautiful week, and good night.